All right, so I tried to take an overwhelming amount of information and make sure that it only lasted 3 to 4 minutes, so bear with me. But today I wanted to help share with everyone something that really moved me because of how understudied and how unjust and how much improvement still needs to be done for Native Americans as a culture. They need help and resources and a voice when it comes to a lot of different concepts. But for my final project, I selected to focus on cancer rates for Native Americans due to environmental factors. So we want to start with the basics. What is cancer? A lot of you have probably heard of it, but never really seen the technical side of it. So I wanted to start with a broad and easily termed definition in layman's terms. So this disease is basically when abnormal cells or mutated cells start dividing in the body. And there's not just one type of cancer, there's different kinds, and they can be located in different parts of the body or cause different symptoms. Some cancers are asymptomatic, which is why you do want to communicate with your primary care physician at least annually, because the body changes and anybody can get cancer. So this is something that WebMD can't really help you with. You actually do have to see your primary care physician, and they will recommend you to a specialist. So there are special doctors that complete their residency so that they are more educated on different areas of oncology. And there are different specialties when it comes to cancer, depending on the type of cancer you have and the type of treatment plan that would be best for you. So how I approached this project was I looked for the most common types of cancer that are currently recorded as accurately as possible, at least for Native American people. And then I tried to dig a little deeper and see what is known to influence the prevalence of such cancers and why these statistics were so high. And I used a multitude of resources, including our awesome textbook. And what I tried to do was link the lifestyle habits with the types of cancer that were prevalent in this community. So some major beasts that Native Americans have to face include alcohol addiction, drug addiction, and then something known as hepatitis C, which is not cancer, but it is strongly linked to liver cancer, and it is still a threat to their health. Other current lifestyle habits will also be strongly linked to and influence other types of cancer, such as lung cancer. So why hasn't this issue been really addressed? There is a whole mess of reasons. One being we're not really sure where to start when it comes to helping Native Americans, mostly because there's a really complicated political system involved, um, and also because there's just so many issues that I think people want to tackle, but they have limited resources and limited ways to socially reach out to these wonderful people because they're carrying so much trauma. Um, I think one factor that would really help this culture in the future would just be promotion of education, because health education and public education of these health issues could really address the root of what's going on, which is lack of preventative measures. And one factor that we do have control over, or at least we like to think we have control over, is the accuracy of currently available statistics, but I'm not sure how accurate they really are due to, underreporting, and also not even all of these tribes are currently federally recognized, so we're not getting any helpful data from these groups of people who matter. And so lately, what's been awesome to read is that there's a lot of community action and community involvement, and individuals of the community coming forward and realizing what a huge mistake not taking preventative measures has been, and it was because they were unaware, because it was socially acceptable, and no one really talked to them about what a huge issue certain habits were and why it led to infections such as hepatitis C. And so what you're noticing now is a lot of people are passionate about saving their culture and standing up for their people, and they're really passionate about wanting to make a change. And so especially the American Indian Cancer Foundation has a crazy amount of wonderful resources that are easily accessible and easy to understand, no matter your education level. Cinco is also a great organization. They're just a little tougher to access, and they don't have as many resources or educational means as the American Indian Cancer Foundation. So the scary reality is that no one can fully understand cancer currently, and no one can fully understand why Native Americans are disproportionately and unfairly exposed to certain types of cancer. But with what we have now as far as accessing medical and healthcare data, we are trying to, put the puzzle together and piece everything together to take preventative action and promote public education and promote awareness and promote a healthy sense of not only physical health and healthy lifestyle changes, but mental health too, because suicide and other statistics were playing into why Native Americans were dying outside of cancer. But the truth is there's a major trauma in this community, and cancer shouldn't be one of them. And there's a lot of foundations and resources now that are trying to firmly root themselves in this community and promote positive change.